Hello everyone, welcome to the Heroes Initiative powered by IPCA. These heroes are instrumental in improving quality of life of the patients. Today we have one such hero who has improved life of tens and thousands of such patients. Doctor, we welcome you to the Heroes Initiative by IPCA. So doctor, now we are focusing on cataract surgery pre and post-operative care. So doctor, my first question for you is, what should I expect during the pre-operative assessment for cataract surgery? Are there any specific preparation do I need to make, doctor?
Okay, so cataract surgery now has become very advanced, and the major benefit of cataract surgery is it is a daycare surgery. So you don't have to come, get admitted, and then get discharged the next day. Everything is done on the same day. It's a walk-in, walk-out procedure. You come, you get operated, and you leave on the same day. Now, normally when you come for a eye checkup, and if you're diagnosed as a cataract, basically we do a thorough examination where we dilate your eyes to see how your cataract, which stage of cataract it is, and to also see if there's any other issue along with the cataract. If there's no other issue, if it is only cataract, then normally we do a scan. Basically, it is called an A scan. It is a scan done to check the power of your eye. To basically, in a cataract surgery, what we normally do is, with the help of a laser, we remove the cataract and we place another lens inside the eye. Now, the advantage of placing a lens is basically that you don't have to use any glasses. So basically, post-cataract surgery, 90% of them do not require any glasses. So that is another major benefit of cataract surgery. And once the diagnosis is done, once the scans are completed, we do a general surgical profile, that is just blood tests. And then you can book a date for your cataract surgery. Now, on the day of surgery, the preparation basically time takes about 1 to 2 hours before the surgery, and where we again put the drops, the dilating drops. The surgery time takes usually 10 to 15 minutes. Once the surgery is done, we usually explain the medications to the patient, and we explain about the post-operative care to the patient, and then the patient is discharged, and then the checkup is done on the next day.
What are the most important post-operative care steps to ensure a smooth recovery after cataract surgery, doctor?
Okay. So now cataract surgery has evolved, and now the surgery that we do is called micro-incision cataract surgery, where the size of the incision is only 2 millimeters, which basically means that the surgery can be done without any injection as such. So it is done under topical anesthesia, and the surgery time usually is about 10 to 15 minutes. And once the surgery is done, the advantage of the modern day cataract surgery, that is the micro-incision cataract surgery, is that you can actually resume all your normal activities from the very next day. So in case you want to drive, in case you want to go back to office, you can actually start doing from the very next day. Usually the drops has to be instilled in your eyes for about 1 month's time. And the main post-operative care would be that no head bath and face wash for 2 weeks. Basically for 2 weeks, we do not want any water or any dust going into your eyes. So you can avoid head bath. If you need to bath, you can bath below neck, making sure that there is no water entering your eyes. And it is better to avoid any dusty environment. If you're going to office, or if you're going to malls, or in case you're driving your car, that you can actually start resuming from the very next day.
Agreed, doctor, what you said. Are there any common complications after cataract surgery and how they can be managed or prevented?
So usually cataract surgery in complications post-cataract surgery is less than 0.5%. If there are any complications that were to occur, usually the doctor would know before the surgery itself. So the doctor would normally tell the patient that patient is having some complication, or patient might end up in some complication. In such patients, we usually explain the patient, and we usually tell the patient to be prepared for what is to come. And usually most of the complications during or after the cataract surgery can be easily managed. Extremely rare conditions, in case post-cataract surgery patient gets an infection, normally we have to start any antibiotic drops, or we might have to give injection. But post-cataract surgery infection is very, very rare. We don't usually see that happen. So cataract surgery is a safe procedure, unless if a patient, usually cataract is something that has to be operated at early stages. Now, if a patient comes to us at a very late stage, where the cataract is in stage 4 or stage 5, which basically makes the surgery difficult for the surgeon, then the surgeon usually explains the patient that's when so complication can happen. But again, experienced surgeon can manage any complication.
So doctor, your expertise and insights on cataract surgery pre and post-operative care are invaluable to this initiative, and we believe your participation will greatly benefit the patients.